Still in St. Anne, the parish continues to struggle with a spike in COVID cases. Shamela Pullen has been speaking with officials from the St. Anne's Bay Hospital.
COVID-19, a virus which has proven to have no bounds. This is the St. Anne's Bay Hospital, where among the COVID patients are these newborns. They're twins who contracted the virus from their mother. But it's the adults who appear in greater need of care. Geared up in PPE, we were taken to ground zero. We saw firsthand the impact the virus had on one's respiratory system. Even with the ventilator, some patients struggled to breathe. Ironically, it's a situation all too familiar for the hospital's CEO, Dennis Morgan. Earlier this year, he too became a COVID patient at the hospital he leads.
I spent 11 days here at this hospital, and 4 of those days I was on oxygen. I felt like when somebody put a plastic bag over my head and was just strangling me with the sole purpose of killing me, and that was COVID. I heard the scream, I heard the crying out for doctors, I heard help. And even when doctors were there administering care, it was the most frightening moments I've ever had to have gone through in my life.
This was before vaccines were available in the country. But once they were, Mr. Morgan did not hesitate to take the jab. In fact, he's of the view all medical and administrative staff on the front line should be vaccinated.
Take it for others. Do not be selfish. You don't have the right to be selfish. And I'm saying that, and I'm saying it without apology, because I've seen what the vaccine can do. It saves lives. I've seen what the virus can do. It takes life.
St. Anne has the 4th highest number of COVID cases in Jamaica. But unlike other hospitals we have visited, the COVID ward at the St. Anne's Bay Hospital seemed less chaotic, although the facility has reached its capacity for COVID hospitalizations.
The management of this pandemic is a communication thing. So when the surge went up, that communication had to be instituted so that we let the team knows that your order level is going to need it to be higher than what is expected. One of the aims is to reduce the effect of the number of patients in your accident and emergency, because in the real situation, the ideal situation, your accident and emergency department should be ready to see emergencies. It's not really a ward. But unfortunately, we had to board some patients out there. So every time we did the interventions, one of the main was to reduce the pressure of the number of patients in the accident and emergency.
And so
we had to now come to the conclusion that some of the wards that we had to repurpose them for isolation wards. We have 5 isolation areas. Can you believe it? 5 mounting to 95 beds. And even that is not enough. We still have people boarding in here. And so this is where we have repurposed almost, as I said before, we have 1 ward to serve the non-COVID female, 1 ward to serve the non-COVID male.
Dr. Hamilton also said another strategy implemented is to speed up investigations on COVID patients, discharge them as soon as they're stable to be treated at home to free up bed space for others waiting to be admitted. Of note is the vaccination status of persons hospitalized. I'm told that 99.1% of the persons are not vaccinated, prompting renewed calls for persons to get the jab. Reporting from the St. Anne's Bay Hospital, I'm Shamela Pullen for TVJ News.